Psychology, the study of behavior and mental processes, and physiology, the study of functions of living organisms and their parts, relate to each other in many ways, and especially when examining the minds of overweight and obese individuals. Just as the specialists at Lancaster General Neuropsychology state, obesity is as much a psychological as a physical problem. Psychological issues can not only foreshadow the development of obesity, but they can also follow ongoing struggles to control weight. We all know that overweight individuals are becoming more and more prevalent in the United States, so much so that it's being referred to as an obesity epidemic. In fact, more than 1/3, or 78.6 million U.S. adults are obese. BMI, or body mass index, is a way to compare body weight to height. Less than 18.5 is considered underweight. From 18.5 to 24.9 is a healthy weight. 25 to 29.9 is overweight, and anything above 30 is obese. Of the 30 largest states in terms of the size of its inhabitants, 26 are in the Midwest and South, led by Mississippi. 34.9% of adults are obese, Louisiana 33.4%, and West Virginia 32.4%. Obesity-related conditions include heart disease, stroke, and type 2 diabetes, some of the leading causes of preventable death. The estimated annual medical cost of obesity in the U.S. was $147 billion in 2008, 1,429 higher for obese people than those of normal weight. In a report by Hamburger 1951 describing 18 cases of obesity, 12 of the patients reported being aware of appetite changes while emotionally upset, 7 reported eating when frustrated or faced with a distressing situation, and 8 cases that patients appeared to overeat as one of the many symptoms of an underlying emotional illness. 8 of the patients with a malignant type of obesity were said to be addicted to food which appeared to be a substitute for love, affection, and security. 16 patients were found to be sufficiently disturbed to warrant a psychiatric diagnosis. 12 super-obese women were given extensive psychological assessment by Castelnuovo Tedesco and Scheibel were found to be predominantly passive-aggressive and displaying signs of personality disturbance. Wunderlich 1973 found 16 extremely obese patients entering a hospital for a 6-month weight reduction program to have a low need for achievement, poor personal adjustment, and few preferences for social activities, and to be high in aggression but low in endurance. This is Jennifer C. Collins, Doctor of Psychiatry and Behavioral Medicine, and her expertise actually includes bariatrics, neuropsychology, and stress management. She is one of the authors of Behavioral and Psychological Factors in Obesity, written in 2009. John E. Benz, Ph.D., is a doctor at Lancaster General Health, specializing in neuroscience with an expertise in brain injury, dementia, and neuropsychology. He also co-authored Behavioral and Psychological Factors in Obesity. Their article states that food is often used as a coping mechanism by those with weight problems, particularly when they are sad, anxious, stressed, lonely, and frustrated. In many obese individuals, there appears to be a perpetual cycle of mood disturbance, overeating, and weight gain. When they feel distressed, they turn to food to help cope, and though resulting in temporary reduction of their distressed mood, the weight gain that results may cause a dysphoric mood due to their inability to control their stress. The resulting guilt may reactivate the cycle, leading to a continuous pattern of using food to cope with emotions. Society views obese people as weak-willed and unmotivated. Obese individuals are often aware of these negative views and internalize them, putting themselves at risk for disorders of mood, anxiety, and substance abuse. Up to 70% of obese individuals considering bariatric surgery suffer from a current and/or past psychiatric disorder. If an overweight person decides to get bariatric surgery, there are many psychological issues that follow. Patients sometimes feel that their weight loss is less than they anticipated, and frustration can lead to lack of motivation and difficulty adhering to the post-operative diet. Additionally, some patients who struggled with emotional eating before surgery may return to similar behaviors post-surgery, resulting in less weight loss. An article from the American Psychological Association with the assistance of Sarah Weiss and Nancy Meliter also say that obesity is a mind-body interaction. For example, feelings of sadness, anxiety, or stress often lead people to eat more than usual. Obesity is also frequently accompanied by depression, and the two can trigger and influence each other. Speaking of this vicious cycle, although women are slightly more at risk for having an unhealthy BMI overall than men, they are much more vulnerable to the obesity-depression cycle. In one study, obesity in women was associated with a 37% increase in major depression. There is also a strong relationship between women with a high BMI and more frequent thoughts of suicide. Enough about the bad side of mental health and obesity. There's a psychological solution for this physiological problem as well. Some mental health tips to think about while trying to better obesity are solving the stressful issues that burdened you before starting actual weight loss, and recording what food you put in your mouth, then thinking about how you felt at the time. Was it a good choice or comfort food? A physician can help develop a plan for losing weight that includes both diet and exercise. A psychologist can help with the emotional side of the equation, the stress, depression, or experience that caused the weight gain. In conclusion, psychology can provide many links and explanations to our physiology.